Hello, my friends. We are here with an awesome episode with a pelvic floor doctor. This is actually the first pelvic floor doctor we've had on here. So help me welcome Dr. Johanna Gaffney. She is a doctor of physical therapy and specializes in pelvic floor physical therapy. She works with the Hope Docs here in the Tampa Bay area in St. Pete, which is awesome. And they offer both in-person and virtual sessions. And what's cool about Johanna's journey is that she's had her own pelvic floor dysfunction, which is what actually led her to this very awesome specialty and helped her see how hard it can be to communicate about these things and how important it is to make your patients feel safe and cared for on their journey. So welcome, Dr. Johanna. Thank you for being here.
Thank you so much for having me. I'm so excited.
So we're going to talk about, things people normally don't talk about. I think every person, and I will also say you work with people regardless of gender, correct?
Yes, males, females, doesn't matter.
Yes. Okay. So I feel like when I think about pelvic floor dysfunction, I most often think about people with vaginas. But what's the percentage? Like what percentage of your clientele is, has a vagina versus a penis?
Yeah, I would say about 30% have penises. And
really?
Then about
okay.
70, yeah. I take a lot of male clients, and it's actually one of my favorite populations. So.
Okay. So tell us more about what would be the most common reason that a penis owner would seek out your services?
A lot of times it has to do with sexual dysfunction, but there are multiple things that they can deal with. The thing about the male population is that since there's such a stigma with pelvic floor dysfunction in the male population, no one really talks about it. So I actually see a lot of my male clients have taken so long to find that pelvic floor therapy is what's for them, right? Or it can help them.
Okay.
But as far as symptoms and diagnoses, I see with sexual dysfunction, erectile dysfunction, premature ejaculation, pain with ejaculation, pain with erections. And then I also see with urinary dysfunction, hesitation, retention, so not being able to fully empty the bladder, going pee multiple times within the hour to 2 hours, right?
Okay.
So having a higher frequency of urination, and then constipation. But yeah, there's a lot that can go on with male pelvic floor, and then with prostate issues as well, like post-prostatectomy, things like that. So
interesting.
It's really interesting.
So, if I'm the average consumer, I feel like I would be confused. Okay, I'm having some erectile dysfunction. How do I know? Do I go see normally I think people would go to a urologist, right?
Right.
How do you know when pelvic floor physical therapy would actually be the better choice for them?
Yeah. So if you have erectile dysfunction and you notice that you have other symptoms, right? So let's say you have erectile dysfunction and you have constipation, and you have pain with ejaculation, and you're having a difficult time fully emptying your bladder. That to me tells me there's a little bit more going on than just the erectile function, right?
Yeah.
And then usually, yes, they'll go to the urologist. Hopefully, if you go to any sort of doctor, they'll recommend pelvic therapy, but that's not the case all the time. So yeah, just usually what I see is my male clients had to do their own research, but it's becoming more of a thing, especially in the St. Pete area. There are a lot of urologists that refer to pelvic therapy, which is great.
Yeah. That's cool. I'm curious, especially just because I don't have a penis. What does the process look like for men, And if somebody was going to go to pelvic floor physical therapy, which I do think is becoming much, much, much more popular than it was even 10 years ago. I feel like it's kind of blowing up. I do calls for the Peanut app, which is a lot of new moms. And it used to be even 3 years ago when I first started doing it, a lot of people had not heard of pelvic floor physical therapy. And now when I mention it, people are like, oh yeah, I've done that already. And I'm like, oh, okay. Things are changing.
I love that so much.
Yeah.
Yeah. But to answer your question about the process for males. Since males don't have a vagina, right, you can assess the pelvic floor internally through the rectum. So a lot of times it involves a rectal assessment, rectal treatment, because that is a really great way to see what those muscles are doing. And
Okay.
if I get a male client calling me, inquiring about therapy, or just on day one, like I always educate them about what that entails and why, because I don't think in the beginning people don't understand why it's necessary, but once you explain it, they're like, oh, that makes so much sense, right? Because
Right.
you can't see the muscles, you can't see the pelvic floor muscles, you have to feel them, you have
That's
to
what's
see
so tricky, because I went to pelvic floor physical therapy back when I lived in Chicago, and then I saw your colleague who's no longer with the Hope Docs, but I worked with your practice too, and part of it was like, I think it's important for me as a provider to like understand the other providers and my
right,
field and be
right.
able to speak to it. But yeah, I remember kind of originally being educated about like, oh, well, there's this muscle. And I'm like, what? And she showed
It's
me like a
crazy.
model of the muscles in my pelvis. And I don't know. I just came up thinking like you have like biceps and triceps and quads, and you can like see those muscles and they're like meaty in a certain way. And you like see them moving. And so I was like, I don't know. I guess I just thought it was just tissue down there that didn't do much.
Yeah, I know, right? And I think a lot of people think that. And especially with the male population, like I've had people say, like, wait, males have pelvic floors? I'm like, yes, we
Right.
all
So,
have them.
oh, this. So yes.
Yeah. It's just a little different and it's not talked about as much.
I know. That is so interesting. And does your work focus mostly on muscles, or are you also focusing on like ligaments, tendons, nerves, all of that?
It's just the general relationship between it all, right? So it depends on the person. Like if they have muscle imbalances, that can contribute to nerve pain because the muscles are tight and compressing the nerve. So
Makes sense.
yeah, so it's really just like zooming out and seeing the whole picture, seeing what structures are involved, what could be contributing to the symptoms. And the way that we approach it with the Hope Docs is we like to zoom out and see the whole body, like see the whole picture. And that's why meeting with you the first time was so great, because the brain and the mental health perspective of it, like it's so, so important with pelvic floor dysfunction.
Yes, I agree. I think our two specialties like fit together very well.
Yes.
Like you said, even the difficulty being able to communicate about what's happening with your body, and I think,
Yeah.
yeah, there's somebody like fairly close to me who had some like vaginal prolapse, which we can talk about that too. And like didn't say anything. Didn't say anything to me of all people. You know what I mean? I'm like, I'm certainly not judging over here. But I think that there's just so much programming that like we're supposed to just magically be these like sex gods with no effort.
I
And we should
know.
never, need any repairs or support. And we also shouldn't need any education because we don't get any.
No, we get
Unless you're
none.
like you or me, where we like go seek out a very like specialized thing after we already have an
Right.
advanced degree. And it's like, yeah. So it's very unrealistic expectations, I think, that so many of us have of ourselves. What do you see with that? Like, what do you see with people in terms of just like discomfort, self-consciousness, shame, that kind of thing?
See a lot, but I think the main things that I see and that I've experienced myself is that when your body isn't cooperating with you the way you want it to, it can be so frustrating.
I know.
And you start to, I see it where my clients and myself, like I've dealt with it too. And I always like to share that because I want people to know, like, this is something that a lot of people deal with,
Yeah.
Eliminating that stigma and that shame. Like, you start to internalize it and you're like, why the heck isn't my body acting the way I want it to? Why can't I want to have sex all the time? Why can't sex feel good anymore? Right. So it's things like that I see a lot of, and people start to blame themselves. And that is just going to make the problem worse because your body doesn't feel safe to heal. So I talk about that a lot with my clients, like educating them on how can we make the body feel safe again? How can we change that mindset with affirmations and deep breathing and nervous system regulation so that our body is like, okay, like I'm okay, I'm safe, this is okay. And that's how you start that healing process.
That's so interesting. Like, how much of the healing process do you think that is just sort of feeling
Very, very large portion of it. It's a huge for, I mean, there's obviously the muscular component, the nerve component, like all of that is the diaphragm lengthening, like all of the different things we look at with the human body when it comes to the pelvic floor. That's the main part of our education. But if our body isn't feeling safe enough to receive those cues and that new way of interacting, right, it's not going to work. So the mind body connection is so important. I tell my clients who have painful sex or any sort of pain in that region, like getting therapy with a sex therapist is so important because we just need to reframe that mindset, you know, and stop putting so much pressure on ourselves to be all of the things all the time.
Yeah. And I think people are starting to figure out that connection between the mind and body. And for myself, even, it's sometimes just noticing, oh, I'm holding tension that I don't actually need to hold right now. Or, oh, I'm almost like holding my breath or something when that is clearly unhelpful.
Yeah, right. We all do it.
So I think even just starting to notice that, you know, if people are listening and like, how do I start, you know, connecting with my body or creating that safety? I think just giving yourself permission to like release when you notice you're holding your breath or tensing your muscles.
100%. I actually tell a lot of my clients, set a 30-minute reminder on your phone. You don't need to label it anything. Just put like a smiley face. Like you're the only one who needs to know what it means. And just do regular body scans. Like, am I clenching my jaw? Am I clenching my butt muscles? Like, am I clenching my pelvic floor? Have I taken a deep breath in the last 10 minutes, right? Like, that will make a huge difference because those are small habits that accumulate over time, you know?
Yeah. I love that. Sometimes I think with all of us humans that we just like almost don't want it to be that easy.
Yeah, right.
Like, you should give me all these exercises and I should have to do all this really hard stuff.
It's so hard.
Right. What if you actually just get to like feel more relaxed and like take a deep breath? That sounds great, doesn't it?
I know. And I feel like with some clients, like the biggest thing I want them to do is to stop doing so much, which is like a foreign concept in our society. But it's not that they have to stop doing, but it's more just like stop holding, stop trying to control everything. Like, let's just surrender.
Yes.
And that will manifest in our body too. We'll feel that release in our body.
Right. And I mean, that's just part of the work I do too. I mean, a lot of times when people have low libido, it's because they're in, you know, fight or flight mode.
Yeah.
You know? And it's kind of like, I got to do this, I got to do that. And there's a lot of providing for other people or meeting demands or expectations of other people, whether it's, you know, a boss or your children or your spouse. Yeah. And I think to kind of just pause and rest and relax at first can feel really counterintuitive and like, I don't know, like you're just wasting time.
Right.
Know? But actually, I think like you're saying, not only you're not wasting time, you're like actively healing your body and you're going to be in better shape than ever.
Exactly. And I love that you emphasize that because I think we're so programmed to be like, okay, what are the things I have to do about this?
Yes.
But yeah, sometimes it's the opposite. Like,
right.
What are the things we need to just
do? What actually is going to feel great and restorative?
Exactly. I love that.
Yeah. Or getting to do nothing. Maybe it's just like lay on your bed.
Which is really hard. I feel like we're always trying. I mean, I could go on and on about this, but we're always trying to be stimulated in some way, right? Yeah. And do any of us practice being bored anymore, or just like focusing on our breath, or just like trying to just still the mind?
I know. Really and I'm a big Eckhart Tolle fan, and I was a practicing Buddhist for 13 years, and
oh my gosh,
both of those things were basically saying you need to be bored, and like all we do is try not to be bored.
I know. I mean, when we were kids, like when I was younger, I was bored all the time.
Yeah.
Like summer break, I
Yeah.
would get so bored. And yeah, it was uncomfortable, but I was like used to it. Now I'm
Right.
like, okay, I'm bored. I'll go on my phone or I'll get some work done or
I know it's
I'll
so
do
easy now,
something.
like avoid feelings. I know.
Yeah.
It's true. Okay. Well, so hopefully we've convinced everyone to relax more.
I know it's the first step.
No. I'm also wondering with pelvic floor physical therapy, like, do people feel like scared that like you're basically touching them in places that they're not normally touched? Or are they kind of like, touch my back, touch my vagina?
Yeah. I mean,
Yeah.
that's a natural fear, right?
Yeah.
I always validate that first thing. I'm like,
Well, that's nice.
first of all, this is a huge step you're taking coming in here, right? Like, so congratulations, you made it. That's the hardest part. Second of all, with the internal exam, I always, always, always emphasize this, but it's never urgent. Like if this is something you don't want to do today, that's totally fine. There are so many things we can do day one that don't involve an internal exam, rectal or vaginal. It doesn't matter.
Okay.
So I always say that because there are like so many other things we can focus on. So if it's just like that day one, you just don't feel comfortable, that's totally fine. Even if day two, session two, like you still don't want to do it, that's also fine. Like we can still make so much progress.
Okay, that's encouraging.
Yeah, but I also like once it does happen and they get through it that first time, usually people are like, oh, like that was actually really relaxing. Like it's okay. You know?
You're kind of helping relieve tension in the pelvic floor, right?
And it's really helpful. And I have like all the music, the essential oils, like trying to make it a calming experience. So
yeah. It sounds lovely that you're like helping people feel more comfortable. And as I'm hearing you discuss it, it's like, yeah, like why would we feel any different towards our pelvic floor than we would towards like our shoulder or our knee, you know?
Exactly.
So
I know.
Or it's like totally fine to need help with your knee. It's very socially acceptable, but you cannot like, it just seems so silly in a way that we're like choosing certain parts of our body that shouldn't need help.
I know. It's I know, right? I know. I completely agree. And I think we're starting to make progress towards that, right? Just as a society, like talking about our pelvic floors and our sex lives and like things like that. I think that will gradually help, but there's still so much shame and guilt around that area regardless, you know, and it's so interesting. But it does contribute to a lot of the things that people deal with. I'm sure you've seen like in your work where if someone grew up and they weren't allowed to talk about sex or self-stimulation or anything like that, it can manifest into other sexual issues, right? Yeah.
Yes, it's interesting. Yeah, when people grow up really conservative around sex, or if they were like caught masturbating as a kid and shamed for it, or if they were exposed to porn too young, or saw negative behaviors in their family that caused, you know, unwanted trauma or chaos. There's so many things.
Right.
I mean, with your field, I'm also thinking, and mine too, the idea that genitals are called private parts, you know, or that we make up other like silly names for them.
Yeah.
You know?
Yeah. And I've been seeing, because a lot of my clients are moms, right? And I've been seeing a lot where people are starting to teach their kids like actual anatomical names. Like that's a penis, that's a vulva, because everyone thinks it's just vagina, but it's vulva.
And the vulva is the outside part that you can see, everybody.
Yes, exactly. But yeah, just like using the names. Like it's just like if, like you said, this is my shoulder, this is my elbow. Like these are parts of our bodies. It's no reason to be afraid of calling them what they're called, right?
Yeah. Yeah. And if you haven't been, if you're like, oh, I'm having an awakening as I'm listening to Heather and Johanna talk.
Hopefully.
Do a little healing parts work or a little healing ceremony, you know, with your genitals and kind of be like, I'm sorry, vulva, vagina, penis, scrotum, whatever parts you've kind of been not so nice to, you know, and can kind of bring some compassion and some self-love in there.
100%. I love that. Because that's a huge part of it. Like affirming to yourself that every single part of our body is meant to be there and deserves to be there. Like we don't have to hide it, you know?
I know. All right. Well, let's talk about people with a vagina and what are some of the presenting issues they come in with? Like what are some of the most common ones?
Yeah. So when people think of pelvic floor therapy, usually when I say that's what I do, most people think prenatal work, like pregnancy, postpartum, right? Which is a huge part of what I do. But everyone, like we said, everyone has a pelvic floor. Everyone can have pelvic floor dysfunction, right? So symptom-wise, if you have a vagina, you can have the same urinary symptoms, bowel symptoms, right? So constipation, bowel urgency, leakage. You can have like retention with urine, leakage with urine too. So if you pee when you laugh, when you sneeze, when you cough.
Super common after giving birth, right?
So common postpartum, yeah. And in like the older population as well, like we can still make changes. I hear that all the time, like, oh, well, like I peed when I laughed, but I'm 60, you know? But it's like, okay, and like we can still strengthen your muscles, you know?
Yeah, right. It's like you still have muscles, they still work.
Right. So that's a huge thing. Like we said, pain with intercourse. If there's any sort of pain with vaginal penetration, pain with using tampons, that can happen at any stage of life.
Okay.
And prolapse, like you mentioned before. So
what are some of the most common pain ones? Because I hear a lot from people, oh, I'm having pain during sex, you know, and I don't, I usually will just refer them to you.
Thank you. Love that.
Okay, you need to talk to a pelvic floor physical therapist about this. But yeah, I mean, I'm familiar with, I feel like I'm going to say the words wrong, but vaginismus, I know that's a real one. And then is it like dyspareunia or something like that? How would you say it?
Yeah, so dyspareunia is basically just the diagnosis of pain with intercourse. So there's a lot of words that are kind of thrown around with diagnoses. So like vulvodynia is any pain in the vulvar area. Vaginismus is pain in the vagina, right?
Got it.
Vestibulodynia, that would be pain in the vestibule. That would be like, this is the vagina. It's like right at that superficial opening.
Okay.
So there's a lot of different things that can happen, whether it was triggered by hormones, hormonal changes, right? Triggered by a tight muscle, or even if you tear during birth, like that can contribute to pain with intercourse. So there's so many things that can go into it when you feel it. Like if you felt it when you first have penetration, so like initial penetration, deeper penetration with thrusting, like there's a lot of different varieties of it. But, and again, like there's so many different things that can go into it. Usually what I see is that there's an imbalance of the muscles, and that can contribute to not having proper relaxation during sex. It can be painful, you know?
Yeah. I think that's what I learned when I went. I was like, oh, like one side was more tense and one side was more relaxed or something.
Right.
Yeah.
And that happens, it's very common with the muscles. Like I do see a lot like asymmetric behavior of the muscles basically. So that can contribute to pain. If the muscles, again, if they're tight and compressing on a nerve, that can contribute to symptoms as well. Like, I don't know if you've heard of pudendal neuralgia. That's a huge diagnosis for males and females, but basically the pudendal nerve goes and innervates the pelvic floor muscles. So if it gets compressed, that can lead to pain, any sort of nerve symptoms like burning, numbness, tingling, things like that. So there's a lot, but
there really is a lot. And then I'm also thinking of like persistent genital arousal disorder. Is that something with too? Because that tends to be like a nerve issue.
Yeah. And a blood flow issue too, right? So like if there's an imbalance of the muscles and we're not getting proper blood flow to the genitals, that's going to contribute to dysfunction there. Yeah. You know?
Interesting. So with all of this stuff that you do, I know you offer virtual services. I'm asking about this just since a lot of our listeners don't live in the Tampa Bay area. Right. How do you work with people virtually?
I love my virtual clients. I think it's awesome because I love having people face to face, but
Yeah.
virtually I can teach them how to do an internal exam on
Oh
themselves.
my God, that's amazing.
Yeah, so that's really great. And we get a lot like the same information from that versus if I were to do it, right? They're just doing it and they relay the information to me.
Okay.
I can teach them self-management techniques. We do a lot more movement in our virtual sessions because I can't put my hands on the clients, right? So
Wow.
it's very movement based. And I see a lot of great results with that because they basically learn a lot of independence through that. And you get a lot of really great body awareness training with
I
that
could see
too.
that. They're
So
not dependent, like overly depending on you.
yeah, and it makes them feel empowered. And I love that. Like at the end of the day, I don't want you to need me at all. Like that's the goal, right? So
Oh, I feel that way too. I'm very mindful of people like using me as a crutch. I'm like, oh, no, no, you will be doing the work.
I know, like I want you to graduate from me. Like I want you to feel so trusting of your pelvic floor that you only need to come in for those 6-month check-ins. Like, and we'll be like,
Right.
all right, you're doing great. Just work on these few things. And you're like, okay, cool. Like I got this, So that's always the goal.
Yeah. Yeah. That's cool. Okay. So let's go back to the pain though. So the pelvic
Okay.
pain for vulva, vagina situations here. So, and the hormonal changes, that's what I wanted to ask you about. So is that something you can help people with? Because I wouldn't have thought of pelvic floor for hormonal changes.
Yeah. So we don't, as PTs, like we don't prescribe medication, right? But with regards to pain in the vaginal area, like if it's more in that superficial area and the tissues look to me like they could be red, irritated, maybe there's some atrophy there. So the muscles are kind of starting to lose some of their integrity. That to me shows me that there could be a hormonal component.
Okay.
So that's when I would get in touch or refer my client to a gynecologist that can
Okay.
prescribe them either oral hormone therapy or like topical estrogen, testosterone, things like that, whatever they would need, right? Everyone's different. But that can be really helpful for just improving the actual health of the tissue because I can help with muscles, but if the tissues are lacking hormones, then there's only so much we can do. So I always refer out with that and then doing pelvic floor therapy and hormone therapy and like doing that together.
That sounds really impactful for people.
Yeah.
And when you say the tissues, you mean not the muscles, just like the skin?
Yeah. So, like the skin surrounding the muscles, sometimes the muscles won't be able to fully lengthen if there's not enough estrogen, anyways, because
Interesting.
they aren't able to relax all the way. Right. And they don't have the strength. So, a lot of times, like postmenopausal women have a really difficult time with strength in the vaginal muscles. And it hurts when they have sex because the tissues are dry. There's not a lot of lubrication and the muscles aren't getting full stretch and full contraction. So if there's like a deficiency in estrogen, that can lead to some of those symptoms.
Okay. And when you work with people that have pain issues, what are the things that you see are most helpful with that?
Pelvic floor wise, usually with the internal work in the beginning for sure, like learning what relaxed is. Usually my clients that have pain vaginally or with any sort of penetration, the muscles are very tight and they can't fully relax them. So learning what that is and helping them down regulate those muscles.
Yeah.
And then we do a lot of nervous system work too. So what I find a lot with pain during sex is that the nervous system is like all the way up here because we're stressed out, like you said. We're in fight or flight. So our body is going to hold on to those muscles and try to protect us, right? And it's a cycle. Like if there's pain, our body's going to protect us more and close that door. So the muscles are going to be tight trying to protect us, but it's only going to make that pain worse. So
Yeah.
it's so important to get help for that because if you continuously try to fit something in when the muscles are saying no, like it's going to make that pain worse.
I know. It's so important emotionally and physically to honor the signals your body is giving you. Right.
Yeah.
And I think pain, like you said, is a great example. It's like physically your body might be saying, I need more estrogen, or, I need to learn how to relax. And emotionally, your body might be saying something to you too. Like, this person doesn't feel trustworthy, or I don't want to be vulnerable with this person. That doesn't feel safe right now.
Right.
Yeah.
And I sometimes it depends on the client, but eventually that question comes up. Like, is there anything going on in your personal life that could be contributing to this? Whether it's the relationship or, again, like your history of your idea about sex and your idea about your genitals. Like, could that be contributing? Have you had any history of sexual trauma? Like, all of that does matter.
Mm-hmm.
And that's when having you on the team, like, is really, really helpful.
Yeah. I also want to ask about orgasms. Fun topic.
Okay, great. Love it.
I get asked a fair amount, hey, like, I'm not orgasming a lot, or I've never had an orgasm. And I'm curious, from your perspective, are difficulties orgasming for people with a vulva, vagina? How often is that pelvic floor related?
It's very often people have those issues. So
Okay.
if we think about, let's talk about what the pelvic floor should do when we're supposed to orgasm, right? And then we'll go from there. During any sort of stimulation, like self-stimulation, penetration, whatever it is, right? The muscles should be relaxed because we're trying to, if it's vaginal penetration, we're trying to allow things to come in, right? So we want either a penis, whatever you're using inside. So we need to relax those muscles. And that allows blood flow to come in, right? If the muscles are really tight, blood isn't going to flow there. It's not going to, the vessels will be closed because the muscles are so tight. So the muscle or the blood can't come in. But basically, in the beginning, when we're getting aroused, we want to be relaxed. Our body should be relaxed. Our pelvic floor should be relaxed. And then as you get more aroused and you feel that climax coming on, your body will, and it will subconsciously engage your pelvic floor. So you'll notice, like, you'll do a Kegel when you're about to have an orgasm, and that's normal. And you should really just try to let your body do that involuntarily, because that is a natural reflex. And then that allows us to climax, and then we relax again, right? So it's kind of that, like, relaxed, and then you engage, and then you relax again after the orgasm. So that's normal. So what I find a lot with difficulty orgasming, it's where the muscles are all the way up here in the beginning, right? So we're engaging our pelvic floor when we probably shouldn't be. We should be fully relaxed, right? So then when we go to orgasm, we can't engage the muscles if they're already up here, right? So it's a really hard thing to do. If you're flexing your bicep and you go to try to do another bicep contraction, you're like, well, there's nowhere to go.
Yeah.
Right? So it's the same, similar concept. Obviously, it's a different muscle, different structure, but you can't, it's really difficult to orgasm that way if your muscles are already tight, right? So I see that a lot. And in regards to, like, retraining that, like, obviously we'll do a lot of work to find what relaxation is, but a lot of times I try to just tell my clients, like, let's let go of the goal to orgasm and just focus on what you're feeling.
I always say that. I'm glad
I love it. I'm like, yes.
I'm like,
so it's
stop
approved by
trying so
you.
hard. That's the biggest thing getting in your way.
I know, because when we try, again, like, it goes back to how do we get our bodies just release control?
Yeah.
Like, just surrender, and it will help, right? So, yeah, that's kind of the rundown of it. But basically, relax, engage, relax.
So much sense. And, like, I like the bicep analogy too. It's like you need to kind of have the full range of use of your muscle. It can't just be kind of in this limited range and not able to kind of be responsive.
Yeah, absolutely. And obviously the pelvic floor is structured way differently than a bicep muscle, but I think just, like, visualizing that for the analogy purpose of it, and, like, with an orgasm, it makes a lot more sense to people than trying to visualize what the pelvic floor is and, like, what it's doing and whatever, it's just a lot to think about.
Right. Like if they see you, obviously I'm sure you have like a model of the pelvic floor.
Yes. I mean, there's one right there.
Well, I can't see it right now, but maybe they can see it on the camera.
Oh, yeah. It's like a picture.
Oh, nice. But yeah, I think understanding it more. And I was told, because I think I was told, we should also talk about the Kegel myth too.
Okay. I'm down.
Now, I was always like, it's just a Kegel. And then when I actually went in, they were like, no, you do not need to Kegel. You have a very strong Kegel muscle. You need to learn how to relax.
Exactly.
And so I think it was more like breathing, and like every time you inhale, your pelvic floor should go outwards and relax.
I love that. Yeah.
Oh, okay. So that was helpful to me. But yeah, so what are your thoughts on this idea that like everyone's like, I need to Kegel to help my pelvic floor?
I mean, it's crazy because that's like I was hearing that growing up, right? I was like, when I was younger, people were like, "Oh, do your Kegels, like that's how you have better orgasms and you don't pee your pants," you know? So
yes, exactly.
Yeah. And I'm not like fully against Kegels. I think they have their time and place. But I think you should get evaluated first before you just start doing Kegels because like you said, a lot of us are tightly wound and our muscles are all the way up here. So we're very tight. So if we do more Kegels, that can make pain worse. It can make those muscles not act properly, right? It's just the same idea. Like you can't contract an already contracted muscle. It's very, very difficult. So that's my thoughts on Kegels. But I do think if you're having a difficult time actually doing a Kegel and you don't have a lot of tension in your pelvic floor, they can be really helpful. It just depends on the person. But yeah, not everyone should do Kegels, especially if you're having any sort of pain with intercourse, tailbone pain, things like that. Like Kegels will likely make it worse.
Yeah. I think the moral of this story is like, do not self-diagnose people.
Yeah, I know. Well, it's like the internet.
Yeah. They're avoiding working with you or with me so hard sometimes that they're like, I'll just like decide myself. And it's like,
I know.
We'll get a professional evaluation.
I mean, I get it. Like I've been there. I'll go like look things up and scare myself and be like, okay, well, I'm diagnosed with all of these 5 things, you know? And I'm probably not, but it's okay to ask for help, right? And I think that's like the goal. And I get the sense that you feel the same way. Like we want this to be something that people feel safe to come to us with, right? It can be scary on day one. Like that is normal. It's okay. Yeah. It's an uncomfortable experience, but when you experience it, you'll understand like this is a great opportunity to just learn about my body.
It really is, you know, and I think that's how I want people to feel about my work too. And I think that, you know, you seem like a very approachable person. I would think a lot of people do feel very safe with you. So I mean that's also worth people considering as like, you know, like find the right person, find someone you feel comfortable with. I always tell people, even if they're like interviewing me, I'm like, go talk to a couple other people too. Like make sure I'm the person you want to work with. You know?
Yeah, because everyone's so different. And like some people vibe, some people don't. Yeah. Some people like certain approaches, and that's totally fine. Like I just want you to get the support you need, you know, whatever that means.
I love that. Thank you so much for sharing just like all of this wisdom and knowledge with us about our pelvic floors.
Of course. I loved it. I could honestly talk for hours.
I know. Yeah, it's an important topic. So there is a lot to it. And I know we just scratched the surface, but I hope this was an overview for people. If people are like, hey, I probably do need help with some of these things. And, you know, how can I find Johanna and the Hope Docs? Where can they find you?
Yeah, so I'm on Instagram, the Hope Doctors Instagram, and then I have a personal professional Instagram too. So I don't know if you can like link those.
Yeah, we can link to both.
Honestly, I don't remember what my username is.
We'll find
have to link that.
Put it in the show notes.
Okay, and then so that's Instagram, and then we also have the website, like the Hope Doctors website, where you can book your first appointment there. So
obviously, you guys are great. Like I said, I was a patient myself, so they're legit. I recommend them.
Love that.
Thank you so much for being on here. This was awesome. Thank you, everybody listening, and we will catch you next week on another episode of Ask a Sex Therapist.